1. What is the primary cause of psoriasis? A. Fungal infection. B. Genetic mutation. C. Immune system dysfunction. D. Bacterial infection. Answer: immune system dysfunction. Rationale: psoriasis is primarily caused by an abnormal immune response where T cells mistakenly attack healthy skin cells, leading to the rapid production of new skin cells. Other options are incorrect as psoriasis is not caused by infections. 2. Which of the following is the most common type of psoriasis? A. Guttate psoriasis. B. Pustular psoriasis. C. Plaque psoriasis. D. Inverse psoriasis. Answer: plaque psoriasis. Rationale: plaque psoriasis is the most common type, characterized by raised, red patches covered with silvery white scales. Other types, such as guttate and pustular psoriasis, are less common. 3. A patient with psoriasis is prescribed topical corticosteroids. What is the primary purpose of this medication? A. To reduce inflammation. B. To fight infection. C. To exfoliate the skin. D. To increase skin cell turnover. Answer: to reduce inflammation. Rationale: topical corticosteroids reduce inflammation by suppressing the immune response, which helps control the symptoms of psoriasis. They are not intended to fight infection or exfoliate skin. 4. What is a common trigger for psoriasis flare-ups? A. Eating spicy foods. B. High levels of stress. C. Drinking caffeinated beverages. D. High-fat diet. Answer: high levels of stress. Rationale: stress is a well-known trigger for psoriasis flare-ups. Other options, such as spicy foods or caffeine, are not commonly linked to flare-ups, though diet can influence general skin health. 5. A patient with psoriasis presents with painful, swollen joints. What complication should the nurse suspect? A. Psoriatic arthritis. B. Osteoarthritis. C. Rheumatoid arthritis. D. Gout. Answer: psoriatic arthritis. Rationale: psoriatic arthritis is a common complication of psoriasis, leading to joint pain and swelling. This is different from other forms of arthritis, such as rheumatoid arthritis, which involves a distinct autoimmune mechanism. 6. What is the most appropriate non-pharmacological treatment for a patient with psoriasis? A. Limiting sun exposure. B. Moisturizing skin regularly. C. Avoiding exercise. D. Reducing fluid intake. Answer: moisturizing skin regularly. Rationale: regular moisturizing helps prevent dryness and cracking, which can exacerbate psoriasis. Limiting sun exposure or reducing fluid intake is not beneficial for psoriasis management, and exercise is generally encouraged. 7. Which laboratory test is commonly used to assess the severity of psoriasis? A. Complete blood count, CBC. B. Liver function tests. C. Erythrocyte sedimentation rate, ESR. D. Skin biopsy. Answer: erythrocyte sedimentation rate, ESR. Rationale: the ESR is a marker of inflammation and can help assess the severity of psoriasis. A skin biopsy can confirm the diagnosis, but ESR is used to monitor disease activity. 8. A patient with psoriasis asks if dietary changes can help manage their condition. What should the nurse respond? A. Avoid all dairy products. B. A healthy diet may help reduce inflammation. C. Only a low-fat diet will improve your skin. D. Diet has no effect on psoriasis. Answer: a healthy diet may help reduce inflammation. Rationale: while no specific diet cures psoriasis, a balanced, anti-inflammatory diet can help manage flare-ups. Eliminating dairy or adopting extreme dietary restrictions is unnecessary unless advised by a healthcare provider. 9. Which environmental factor can contribute to psoriasis flare-ups? A. Cold, dry weather. B. Humid, warm weather. C. High-altitude environments. D. Ocean air. Answer: cold, dry weather. Rationale: cold, dry weather can lead to skin dryness and irritation, triggering a psoriasis flare. Humid and warm weather is generally less likely to cause flare-ups, and other environmental factors are not as commonly linked to psoriasis. 10. What is a common psychological effect of psoriasis on patients? A. Anxiety and depression. B. Increased energy levels. C. Increased self-esteem. D. Weight gain. Answer: anxiety and depression. Rationale: psoriasis can significantly impact quality of life, leading to anxiety, depression, and body image issues. Weight gain is not a common effect of psoriasis itself. 11. What is the most effective systemic treatment for moderate to severe psoriasis? A. Methotrexate. B. Topical corticosteroids. C. Phototherapy. D. Vitamin D analogs. Answer: methotrexate. Rationale: methotrexate is a commonly used systemic treatment for moderate to severe psoriasis, especially in cases where topical treatments are ineffective. Other options, such as topical corticosteroids, are more suited for milder cases. 12. Which of the following can trigger or worsen psoriasis? A. Smoking. B. High-fiber diet. C. Regular exercise. D. Drinking plenty of water. Answer: smoking. Rationale: smoking is a well-known trigger for psoriasis, worsening symptoms and increasing the risk of developing the disease. High-fiber diet, regular exercise, and adequate hydration are generally beneficial. 13. What is the hallmark skin appearance in plaque psoriasis? A. Red, scaly patches with silvery white scales. B. Blisters filled with clear fluid. C. Yellowish thickened nails. D. Rashes that appear only during hot weather. Answer: red, scaly patches with silvery white scales. Rationale: the hallmark of plaque psoriasis is the appearance of raised, red patches covered with silvery white scales. Other descriptions correspond to different skin conditions. 14. What is the role of phototherapy in psoriasis management? A. To exfoliate the skin. B. To reduce inflammation and slow skin cell turnover. C. To kill the fungus causing psoriasis. D. To moisturize the skin. Answer: to reduce inflammation and slow skin cell turnover. Rationale: phototherapy involves exposing the skin to ultraviolet light to reduce inflammation and slow the rapid skin cell turnover seen in psoriasis. It does not address fungal infections. 15. Which of the following is a common comorbidity in patients with psoriasis? A. Diabetes mellitus. B. Asthma. C. Lung cancer. D. Crohn's disease. Answer: diabetes mellitus. Rationale: psoriasis is associated with several comorbidities, including diabetes mellitus, due to the chronic inflammation and immune system dysfunction that both conditions share. Asthma, lung cancer, and Crohn's disease are not typically linked to psoriasis. 16. Which type of psoriasis is most likely to develop after an infection such as a streptococcal throat infection? A. Guttate psoriasis. B. Pustular psoriasis. C. Inverse psoriasis. D. Plaque psoriasis. Answer: guttate psoriasis. Rationale: guttate psoriasis often develops following a streptococcal throat infection and presents as small, drop-like lesions. Other types are less likely to be triggered by infections. 17. What is a characteristic feature of inverse psoriasis? A. Scaly, silver plaques on the scalp. B. Bright red, shiny lesions in skin folds. C. Dry, cracked skin on the palms and soles. D. Yellowed nails with pitting. Answer: bright red, shiny lesions in skin folds. Rationale: inverse psoriasis affects skin folds, such as underarms and groin, and presents as smooth, red, shiny lesions. Other options describe different types of psoriasis or other conditions. 18. What is the recommended first-line treatment for mild psoriasis? A. Systemic immunosuppressants. B. Topical corticosteroids. C. Phototherapy. D. Oral retinoids. Answer: topical corticosteroids. Rationale: for mild psoriasis, topical corticosteroids are the first-line treatment. Systemic treatments, phototherapy, and oral retinoids are used for more severe cases. 19. Which of the following is a common complication associated with psoriasis? A. Hypertension. B. Psoriatic arthritis. C. Bronchitis. D. Ulcers in the mouth. Answer: Psoriatic arthritis. Rationale: psoriatic arthritis is a common complication of psoriasis, causing joint pain and swelling. Other complications like hypertension may occur, but are less directly associated with psoriasis. 20. Which factor is most likely to contribute to the development of psoriasis in a genetically predisposed individual? A. Exposure to sunlight. B. Emotional stress. C. Cold, dry weather. D. Trauma to the skin. Answer: emotional stress. Rationale: stress is a significant trigger for psoriasis flare-ups in individuals genetically predisposed to the condition. Sun exposure, cold weather, and trauma can also trigger flare-ups, but stress is a primary factor. 21. What is the primary mechanism underlying the development of psoriasis? A. Decreased skin cell turnover. B. Increased skin cell turnover. C. Decreased immune response. D. Excessive moisture production in the skin. Answer: increased skin cell turnover. Rationale: psoriasis is characterized by an accelerated rate of skin cell turnover, leading to the buildup of dead skin cells and the formation of plaques. Decreased immune response or excessive moisture is not the cause. 22. What is a typical characteristic of the nails in psoriasis? A. Thickened, yellow nails with ridges. B. Bright red nails with a shiny appearance. C. Pitting and discoloration of nails. D. Brittle nails that split easily. Answer: pitting and discoloration of nails. Rationale: psoriasis can affect the nails, leading to pitting, discoloration, and thickening. Other conditions, such as fungal infections, can cause the other nail changes described. 23. What is a significant side effect of methotrexate, a systemic treatment for psoriasis? A. Kidney damage. B. Weight loss. C. Skin thinning. D. Bone pain. Answer: kidney damage. Rationale: methotrexate can cause liver and kidney toxicity, making monitoring of liver and renal function necessary. Skin thinning and weight loss are less common side effects. 24. Which of the following medications is classified as a biologic for psoriasis treatment? A. Methotrexate. B. Adalimumab. C. Calcipotriene. D. Coal tar. Answer: adalimumab. Rationale: adalimumab is a biologic drug that targets specific parts of the immune system involved in psoriasis. Methotrexate is systemic but not biologic. Calcipotriene is a topical vitamin D analog, and coal tar is a topical treatment. 25. How does psoriasis typically affect the scalp? A. Small, itchy bumps. B. Red, scaly patches with silvery flakes. C. Thick, crusty scabs. D. Blisters filled with fluid. Answer: red, scaly patches with silvery flakes. Rationale: scalp psoriasis presents as red, inflamed patches covered with silvery flakes. Other options describe different skin conditions or infections. 26. Which of the following lifestyle modifications is most beneficial for managing psoriasis? A. Smoking cessation. B. Decreasing protein intake. C. High-fat diet. D. Avoiding hydration. Answer: smoking cessation. Rationale: quitting smoking can significantly improve psoriasis symptoms and reduce flare-ups. A balanced diet and staying hydrated are beneficial, while smoking worsens the condition. 27. What is the main goal of treatment in psoriasis management? A. Complete eradication of skin lesions. B. Maintaining remission and reducing flare-ups. C. Eliminating the need for systemic medication. D. Complete removal of all plaques. Answer: maintaining remission and reducing flare-ups. Rationale: the goal of psoriasis treatment is to manage symptoms, prevent flare-ups, and maintain remission. Complete eradication is unrealistic as psoriasis is a chronic condition. 28. Which type of psoriasis is commonly associated with pustules? A. Pustular psoriasis. B. Plaque psoriasis. C. Guttate psoriasis. D. Inverse psoriasis. Answer: pustular psoriasis. Rationale: pustular psoriasis is characterized by the presence of pustules or blisters filled with non-infected pus. The other types of psoriasis do not typically involve pustules. 29. What is the role of topical vitamin D analogs in psoriasis treatment? A. To reduce inflammation and slow skin cell turnover. B. To exfoliate dead skin cells. C. To hydrate the skin. D. To treat fungal infections. Answer. To reduce inflammation and slow skin cell turnover. Rationale. Topical vitamin D analogs like calcipotriene help regulate skin cell growth and reduce inflammation. They do not treat fungal infections or exfoliate dead skin. 30. What should patients be advised to avoid in order to prevent psoriasis flare-ups? A. Overexposure to UV light. B. Regular physical activity. C. Applying moisturizing creams. D. Taking medications for other conditions. Answer. Overexposure to UV light. Rationale. While moderate UV exposure can help treat psoriasis, overexposure can trigger flare-ups. Regular exercise, moisturizing, and using medications as prescribed are generally beneficial for psoriasis management. 31. What is the primary characteristic of palmoplantar psoriasis? A. Thick, red patches on the palms and soles. B. Small, itchy bumps on the face. C. Silvery scales on the scalp. D. Blisters filled with clear fluid on the body. Answer. Thick, red patches on the palms and soles. Rationale. Palmoplantar psoriasis affects the palms of the hands and soles of the feet, causing thickened, red patches. The other options describe different forms of psoriasis. 32. Which of the following treatments can be used for localized psoriasis? A. Oral methotrexate. B. Topical corticosteroids. C. Biologic therapy. D. UVB phototherapy. Answer. Topical corticosteroids. Rationale. Topical corticosteroids are the first-line treatment for localized psoriasis. Oral methotrexate and biologics are typically reserved for more severe, systemic cases, while UVB phototherapy is used for widespread psoriasis. 33. Which of the following is a common sign of psoriatic arthritis? A. Joint stiffness and swelling. B. Skin plaques that are red and itchy. C. Loss of hair on the scalp. D. Swelling of lymph nodes. Answer. Joint stiffness and swelling. Rationale. Psoriatic arthritis is characterized by joint stiffness, swelling, and pain, particularly in the fingers and toes. Skin plaques and hair loss are related to psoriasis, but not psoriatic arthritis. 34. What is the most common type of psoriasis? A. Plaque psoriasis. B. Guttate psoriasis. C. Pustular psoriasis. D. Inverse psoriasis. Answer. Plaque psoriasis. Rationale. Plaque psoriasis is the most common type, characterized by raised, red patches covered with silvery scales. The other types are less common forms of psoriasis. 35. Which of the following is a potential side effect of topical corticosteroids in psoriasis treatment? A. Skin thinning. B. Nail growth. C. Hair loss. D. Increased appetite. Answer. Skin thinning. Rationale. Long-term use of topical corticosteroids can lead to skin thinning. Other side effects like nail growth and hair loss are not common with topical corticosteroid use. 36. How does biologic therapy work in the treatment of psoriasis? A. By suppressing the immune system and reducing inflammation. B. By directly killing the skin cells causing the plaques. C. By enhancing skin cell turnover. D. By moisturizing the skin. Answer. By suppressing the immune system and reducing inflammation. Rationale. Biologic therapy works by targeting specific parts of the immune system involved in the inflammation and skin cell turnover in psoriasis. It does not directly kill skin cells or moisturize the skin. 37. What is the relationship between psoriasis and cardiovascular disease? A. Psoriasis increases the risk of cardiovascular disease. B. Psoriasis decreases the risk of cardiovascular disease. C. Psoriasis has no effect on cardiovascular disease. D. Psoriasis only affects the skin, not the heart. Answer. Psoriasis increases the risk of cardiovascular disease. Rationale. Psoriasis is associated with an increased risk of cardiovascular disease due to chronic inflammation, which can lead to atherosclerosis and other cardiovascular issues. 38. Which of the following conditions can exacerbate psoriasis symptoms? A. Cold weather. B. Warm, humid weather. C. Regular physical activity. D. High-protein diet. Answer: cold weather. Rationale: cold, dry weather can trigger psoriasis flare-ups, as it can dry out the skin and worsen irritation. Warm, humid weather is less likely to worsen symptoms. 39. What is the primary goal of treating psoriasis? A. To eliminate the disease completely. B. To reduce flare-ups and manage symptoms. C. To cure the disease permanently. D. To prevent joint involvement. Answer: to reduce flare-ups and manage symptoms. Rationale: the main goal of treatment is to reduce flare-ups, manage symptoms, and improve quality of life. Psoriasis is a chronic condition with no cure, but effective management can keep symptoms under control. 40. What is a potential side effect of the systemic drug cyclosporin in psoriasis treatment? A. High blood pressure. B. Skin irritation. C. Weight gain. D. Hair loss. Answer: high blood pressure. Rationale: cyclosporin, an immunosuppressant, can cause high blood pressure as a side effect. Other listed side effects are less commonly associated with this medication. 41. Which of the following is a typical feature of pustular psoriasis? A. Pustules, pus-filled blisters on the skin. B. Large, silvery plaques. C. Small, drop-like lesions. D. Smooth, shiny red patches. Answer: pustules, pus-filled blisters on the skin. Rationale: pustular psoriasis is characterized by the presence of pustules, which are small, pus-filled blisters on red skin. The other types of psoriasis present with different features. 42. What is a common psychological impact of psoriasis on patients? A. Increased risk of depression and anxiety. B. Euphoria and increased happiness. C. Decreased self-esteem. D. No impact on mental health. Answer: increased risk of depression and anxiety. Rationale: psoriasis can lead to significant psychological impacts, including depression, anxiety, and social withdrawal, due to the visibility of the disease and its chronic nature. 43. Which of the following lifestyle changes can help manage psoriasis? A. Smoking cessation. B. Consuming alcohol in moderation. C. Maintaining a healthy weight. D. All of the above. Answer: all of the above. Rationale: smoking cessation, moderate alcohol consumption, and maintaining a healthy weight can all help manage psoriasis and reduce the frequency of flare-ups. 44. Which medication is used to treat moderate to severe psoriasis by targeting specific immune cells? A. Methotrexate. B. Acitretin. C. Biologics, e.g., adalimumab. D. Topical corticosteroids. Answer: biologics, e.g., adalimumab. Rationale: biologics are used to treat moderate to severe psoriasis by targeting specific immune cells involved in the inflammatory process. Methotrexate and acitretin are systemic treatments, but not as targeted as biologics. 45. Which of the following treatments is appropriate for a patient with mild psoriasis? A. Oral cyclosporin. B. Topical corticosteroids. C. Biologic agents. D. Methotrexate. Answer: topical corticosteroids. Rationale: for mild psoriasis, topical corticosteroids are typically the first-line treatment. Systemic treatments like cyclosporin, biologics, and methotrexate are generally used for more severe cases. 46. What is a common feature of guttate psoriasis? A. Small, red, drop-like lesions. B. Large, silvery plaques. C. Pustules filled with pus. D. Thickened, dry skin on palms and soles. Answer: small, red, drop-like lesions. Rationale: guttate psoriasis is characterized by small, drop-like lesions that often appear suddenly, typically after a streptococcal throat infection. Other forms of psoriasis present with different features. 47. What is the role of moisturizers in the treatment of psoriasis? A. To hydrate and soothe dry, irritated skin. B. To remove dead skin cells. C. To cure psoriasis. D. To prevent bacterial infections. Answer: To hydrate and soothe dry, irritated skin. Rationale: moisturizers help soothe dry and irritated skin, which is common in psoriasis. While they are important for managing the symptoms, they do not cure the disease. 48. Which of the following is true about the pathophysiology of psoriasis? A. Psoriasis involves an overactive immune response causing rapid skin cell turnover. B. Psoriasis is caused by a bacterial infection. C. Psoriasis only affects the skin, with no systemic involvement. D. Psoriasis is caused by poor hygiene. Answer: psoriasis involves an overactive immune response causing rapid skin cell turnover. Rationale: psoriasis is an autoimmune disease where the immune system causes rapid skin cell turnover, leading to the formation of plaques. It is not caused by bacterial infection or poor hygiene. 49. Which of the following is a common trigger for psoriasis flare-ups? A. Stress. B. Sunburn. C. Infection. D. All of the above. Answer: all of the above. Rationale: stress, sunburn, and infections are common triggers for psoriasis flare-ups. Managing these triggers is important for controlling symptoms. 50. How does methotrexate help in the treatment of psoriasis? A. By suppressing the immune system to reduce inflammation. B. By moisturizing the skin. C. By promoting skin cell turnover. D. By inhibiting fungal growth. Answer: by suppressing the immune system to reduce inflammation. Rationale: methotrexate is an immunosuppressant that helps reduce the inflammation and rapid skin cell turnover characteristic of psoriasis. It does not moisturize the skin or affect fungal growth.